Amish faith started in 1693 when Jake Ammon led a group of Swiss Mennonite Anabaptists in a division over discipline and practice which began in Switzerland. They believe in adult baptism, simple living, nonviolence, and separation from government. This resulted in a more conservative group called the Amish, while those who disagreed became Mennonites. They came to North America looking for religious freedom and avoiding religious prosecution in the 18th century. The largest population is in Pennsylvania, but larger populations are also found in Ohio, Indiana, Illinois, and other Midwestern states. Throughout the time, they've maintained a rural farming lifestyle. Amish are very conservative and emphasize family, community, and separation from the non-Amish world. They wear plain clothing. Many Amish communities do not use technology or electricity. They use horse-drawn buggies for transportation and attend an Amish school until 8th grade. They speak Dutch. And then there's Old Order versus New Order Amish. Old Order is a little bit more strict in their ways, while New Order has adopted some modern beliefs. They are known for their animals and farmland. So this slide is about the Amish's perception of health and illness. Health and illness for them are defined by the ability to fulfill daily work and responsibilities, not symptoms. A religious outlook is central to their approach to healthcare. Illness is seen as part of God's will. Health decisions are communal and not individual. Values, tradition, and community knowledge over non-Amish expertise. Amish believe in caring for each other and not relying on government programs or insurance. The Amish prefer to self-medicate or make something recommended by friends or family. Their way of healing can include folk medicine, faith healing, herbal treatments, and other non-traditional medical remedies. Like other cultures, they use herbal teas for colds, flu, and digestive issues, specifically elderberry tea. They use garlic salve for skin infections. They use honey for a lot of things like coughs, sore throats, and burns, as well as high blood pressure. Apple cider vinegar for digestion and weight loss. Like us, they use Epsom salt baths for muscle aches, and they use dandelion as a treatment for diabetes. To help with headaches, they drink water with a splash of vinegar. They also use apple cider vinegar on temples and soles of feet for fever. For stomach flu, they also mix elderberry blossoms and peppermint leaves. They use a ton of animal products for a ton of different things. They use burdock leaves for burns and wounds. And they use chamomile tea for asthma attacks. And then to keep up with their physical health, they like to work in the fields and do physical labor. So this slide will be talking about the current healthcare issues of the Amish. For a quick summary, Amish healthcare combines modern medicine and alternative practices. At the end of the day, they do believe God is the ultimate healer, so whether that's they are healed or they aren't healed, they have total faith in Him and that He will decide what is best. They do prefer home remedies. They do not have health insurance, so they will delay seeking care. But they do have community funds for medical emergencies or if the bill is too big. Healthcare issue-wise, like previously mentioned, they delay seeking healthcare since they pay out of pocket. Sometimes they do not seek professional medical care until it is too late, unfortunately. Like I said before, they do not acquire health insurance. And because it's such a small gene pool, because they only reproduce within their community, this causes genetic issues, which in turn is a big problem for Amish culture. So the biggest health obstacle is in fact genetic disorders. The closed nature and small gene pool leads to a higher prevalence of certain genetic disorders. In Lancaster, there is the first Amish community health center named Clinic for Special Children. This specifically helps Amish families with these gene disorders to get a diagnosis and help get treatment. Early diagnosis and treatment is crucial for a lot of these disorders. The Amish communities actually have established programs to help individuals know their risk of passing on these disorders. There are a handful of gene disorders that have only ever been seen in the Amish communities. And while there are many genetic disorders among Amish communities, these are some of the most prevalent. So there's Amish lethal microcephaly, cartilage hair hypoplasia, EVC, PCD, and CFI deficiency. So to have some conclusive points about the Amish, they came over from Europe in the 18th century to look for religious freedom and avoid prosecution. Many have settled in Pennsylvania, specifically Lancaster, and maintain a rural farming lifestyle. Amish healthcare combines modern medicine and alternative practices. While they do prefer alternative practices, their closed nature and small gene pool leads to a higher prevalence of certain genetic disorders. A religious outlook is central to their approach to healthcare. They favor caring for each other over relying on government programs or medical professionals. Since the Amish prefer home remedies over modern medicine, they have a bunch including herbal treatments, folk medicine, and faith healing. A few of these are honey, teas, apple cider vinegar, garlic, and dandelion. Those are all common ingredients in these remedies.